When we think about life-saving medicines, the shots you get at the doctor or the pills sitting right there in your cabinet, we almost always picture these pristine laboratories and incredibly high-tech processing machines. But actually, the absolute most critical parts of a sterile pharmaceutical facility are the things you never even see. Today, we're jumping right into this explainer all about utility systems. We're going to demystify these highly complex behind-the-scenes networks that literally act as an invisible defense shield for pharmaceutical manufacturing.
The sheer level of strictness required by global regulators like the US FDA and the EU is honestly pretty staggering. They state that the defense systems protecting these drugs, take the compressed gases pumped into a room, for instance, must literally be cleaner than the highly controlled clean room itself. That is the incredible standard these utilities are held to every single second they operate.
So, how exactly is this possible? Well, on the agenda today, we're looking at 5 key areas: the utilities defense shield, breathing clean with air systems, liquid purity in water systems, invisible power from processed gases, and finally, maintaining the standard.
Let's kick things off with Section 1, the utilities defense shield, and how we frame this microscopic threat.
The primary threats we're dealing with here are entirely microscopic. We're talking microbes, tiny airborne particles, and chemical contaminants. You can't just clean a room once and call it a day. It demands constant active defense. So while those shiny stainless steel machines get all the oohs and ahs on a facility tour, it's actually the building's unseen respiratory and circulatory systems continuously churning away in the background that actually prevent contamination. They are the true unsung heroes.
Moving right along to Section 2, breathing clean, air systems, and HVAC defenses.
Think of the HVAC system as the lungs of the facility. It cycles massive volumes of air to purge threats constantly. And depending on the room's classification, its breathing rate changes drastically. For a critical Class C clean room, the system has to replace the entire volume of air roughly 70 times every single hour. For a less critical Class D area, it's about 45 times an hour. And all the while, the temperature and relative humidity are completely locked down to prevent any chance of microbial growth.
To give you a real sense of scale regarding what these air systems are actually fighting, 0.3 microns. That's the minute particle size that the facility's final defense mechanism has to catch. To put that into perspective, a single human hair is roughly 70 microns thick. So we're talking about filtering out threats that are a tiny fraction of a hair's width. Crazy, right? So how do they actually pull that off? Well, the air doesn't just go through one filter. It runs an absolute gauntlet. It steps through an increasingly tight, progressive filtration shield. It starts with pre-filters, stopping 10-micron dust, then moves down through fine intermediate filters, and finally hits the room supply terminal, which is equipped with massive HEPA filters. These capture a mind-blowing 99.995% of particles down to that 0.3 micron level. It's literally a fortress wall made out of synthetic fibers.
All right, let's dive into Section 3, liquid purity, water generation systems.
If air is the lungs, water is the facility's circulatory system. And pharmaceutical water isn't just tap water, no way. It's practically an engineered chemical itself. From raw water storage and chlorine dioxide dosing, pushing through micron cartridge filters, to running through highly specific pH and SMBS dosing, the raw water is aggressively and systematically stripped of heavy metals, organics, and any other impurities.
And the whole point of that aggressive process? Absolute perfection. Electrical conductivity has to stay below 1.3 microsiemens, which proves there are no dissolved salts left. Total organic carbon is kept under a minuscule 500 parts per billion. Most importantly, there is a strict, non-negotiable absence of dangerous microorganisms. No E. coli, no salmonella, nothing. The water must be flawlessly pure.
Next up, Section 4, invisible power, processed gases.
Processed gases, like compressed nitrogen and compressed air, are probably the most invisible utilities of all because they frequently interact right with the drug product itself. Now, while nitrogen is heavily tested for things like purity, moisture, and rogue oxygen, compressed air has a laser focus on keeping out hydrocarbon oil traces. Think about it. Just a single microscopic drop of oil from a standard air compressor could absolutely ruin an entire sterile batch of medicine. Because these gases might physically touch the drug product, like imagine blowing air into a tiny glass vial right before it's filled, they are pushed through an ultrafine 0.2 micron point-of-use filter. These endpoint filters guarantee absolute sterility, right at the exact moment the gas enters that most critical, vulnerable zone.
Bringing us to our final area, Section 5, maintaining the standard, the strict rules of upkeep.
Having built this incredible invisible defense shield out of air, water, and gas, we really have to stop and ask, how do we actually know it's working, day after day? Because a shield is only as good as its maintenance, right? An unseen tear in a HEPA filter, a failing automatic valve, or even just a microscopic leak in a nitrogen line can instantly compromise the entire clean room. And the scary part is, you won't even know the contamination is happening until it's far too late.
To prevent that exact nightmare scenario, facilities follow a completely relentless schedule of vigilance. Every single shift, operators are physically verifying that automatic drain valves are clearing out moisture. Every 6 months, critical areas undergo viable particulate testing and gauge calibrations. Then annually, full gas purity tests are run. It is this constant, unyielding cycle of testing systems and replacing filters to guarantee the shield never ever slips up.
This whole fail-safe mentality is even baked right into the room's air pressure. Clean rooms operate at a higher pressure than the dirty corridors outside them. So when a door opens, clean air forcefully pushes out, literally blocking the dirty air from coming in. If that pressure drops even slightly, alarms sound instantly, warning the operators way before unclassified air can ever breach that classified room. Basically, the facility is actively, constantly monitoring its own shield.
I want to leave you with a bit of a provocative thought about the true fragility of these sterile environments. If your facility's invisible shield failed today, would your alarms actually catch it before the contamination did? We've just seen how air is violently purged 70 times an hour, how water is stripped all the way down to the molecular level, and how gases are filtered to a minuscule 0.2 microns. But flawless utility engineering isn't just a one-time achievement. It is a daily, highly structured, invisible battle. Thanks so much for joining me in this explainer to uncover the hidden systems making modern medicine possible. Keep questioning, keep learning, and I'll catch you next time.